itself, and mainly to make life is more comfortable for the people in that respect. And that's the reason, like, I really believe that, like, the preventive part will come before the individual therapy or the diagnosis in that respect. That doesn't mean we don't pay attention to the individual diagnosis and the treatment, but that would not be the primary purpose in that respect. When we talk about comparative medicine, I looked at the social media, because now is the social media is our, unfortunately, our source for information. And I look on the social media and how they define comparative medicine. And it's really like of get to my attention, and this is something new to me, I mean, is they call it is a discipline of experimental medicine that use animal models for human and animals in the translational and biomedical research. And what translational and biomedical research is mainly, I like to call it, what in the old days we used to call it applied clinical research. And it's really like to say, well, it's biological similarities and difference among species to better understand the mechanism of human and animal diseases. You could see the last part of that is really what I like to say is that's the core of the comparative medicine. The leverage to understand the biological similarities and differences among the species. Okay, but there is a purpose to do that, so we can have a better understanding in that way. But the same people who define comparative medicine, they give the second block. Oh, it's also the similarities between and difference between human and veterinary medicine. And they include something like I like to say is very minor components of what comparative medicine is. Animal resources centers, institutional animal care and use committees, okay, plays a major roles. These are, as I said, very minor contribution to the community in general, and in that respect, but I also said this is how the definition came. I also found this through Stanford University, in which they have a department called Comparative Medicine. They define it as a discipline. Now, I didn't know, like, we can call comparative medicine as a discipline of experimental medicine that use animal models for human and animal disease in translational and biomedical research. Again, I think is that I like to say is a narrow definition of comparative medicine. So I already started to talk about the limitations of these definitions. One important thing is here they consider the human is the only species on this earth that it can be considered, and other animals is mainly like were ignored on this planet. They recognize the superiority of humans, which I really think is very important. Don't take me wrong, but also the superiority of humans will not come without a contribution from other animal species as well as plant species, and this should be acknowledged. They also in some way limited the way how nature operates through the interaction of several living creatures, including humans. Nature is not like related to one species. Nature is not related to only mammalians in that respect. Nature is not only related to the insect population, and so it's a combination of everything. I like to call it like the difference between putting a group of trees versus a forest. A forest represents a lot of ecosystem that will not be established as a forest and have very healthy trees without that type of eco-interaction in general. Nature is the same way. And health in our planet depends on a balance between individual species. And that's where I like to call the health status within our environment requires this type of the balance and the harmony between several factors. As usually we call it in comparative medicine, the interaction between environmental health and now is what is being addressed currently as the planetary health in general. I highlighted the last bullet, and that human medicine is not so much different from other veterinary medicine practices, except that in veterinary medicine, we deal with several species instead of one species. And that doesn't mean we are superior to the human medicine, but that really give us some other dimensions that we need to consider when we talk about comparative medicine. So, given that, when I was trained and I practice all the time what my definition of comparative medicine. When I said I is mainly as part of the profession of veterinary medicine, and is mainly the ability of compare and contrast health events and their mechanism among various animal species, including humans, by the way. And that's not different from the first slide I showed you with the definition. But here is, think that way. We are comparing and contrast. And this is usually the strength of the veterinary medicine practice. When a veterinarian will see a cat, immediately will think about any type of health adverse effect in that cat. How is that related to appearing in a cat, in a dog, or how that could appear in a cow or in a horse, given that each of them have different physiological and pathological changes that it can go. And why we do this type of comparison? Because it's better, mainly in our intention, to understand what we need to do in order to interfere with any type of a negative health event in that animals in that respect. And further to that is, I really believe like that type of comparison, as you could see when we will demonstrate about COVID-19, it can be beneficial for the humans in general, but also for human medicine, specifically with that type of comparison. Those of the human medicine practitioners who really start to understand the role of veterinary medicine, you could see they have really advanced in several areas because they started to see the comparison and the contrast and try to practice that whatever they do with their own involvement in human medicine in that respect. Now, I really would like to move a little bit for what's going on with COVID-19, and I also would like to consider like how our global community will be changed, what I call during the post-COVID-19, which I hope it will come soon. I look on the COVID-19 and especially the post-COVID-19 as an opportunity for preventive medicine on a community basis to bloom. And why I say that, because I think is, as I indicated a few minutes ago, the community in general, the public in general, have started to recognize the added value from preventive measures. Now, people will start to recognize washing hands for 20 seconds or whatever is important to avoid the transmission of this virus. But all of us, I hope we understand, washing hands will not only prevent this virus from transmission. Washing hands will prevent several other potential infectious agents, as well as even some of the toxins to be transmitted to us, which is, again, I like to call it basic hygiene is very important in prevention of several of diseases, including, as I say, toxins. So it's not only about infectious diseases in that respect. The profession of veterinary medicine also could optimize on these opportunities. And I emphasize to say is optimize instead of maximizing through their engagement in the comparative medicine and the environmental health expertise. Fortunately, in veterinary medicine, education and curriculum, except in or I should say limited in the Northern American, but the rest of the world, the curriculum is very broad and includes a good background education about environmental health and a good background education in terms of the hygiene and the community medicine. That part, it will be becoming very important now to practice whatever we are doing in the profession of veterinary medicine. And that should come as our contribution to the health community and well-being through linking health, food, and environment in that order. I really believe like that's what it should be done in that respect. I really think is what is called like a wave of health issues that it can come as an adverse to our community. It will be related to food security and including food safety. And that will be what I believe like the profession of veterinary medicine could mainly be an essential contributor to the community well-being in that respect. And I can give a lot of example in that way, but I thought like mainly like we need to move forward in that way. So far, how much we have contributed to
Professor Moore?
Yes.
Professor Moore, I'm sorry, you have 1 more minute.
Okay, I have 2 slides. Okay, so the positive contribution to the current pandemic is mainly from the profession of veterinary medicine. It's mainly coming now through these are my own examples, is the engagement of the American Association of Veterinary Laboratory Diagnosticians in supplying reagent as well as testing for the COVID. How the community now enroll in the companion animals as a potential spread of the SARS-CoV-2. Another issue is the participation of the veterinary epidemiologist in the simulation models for infectious diseases using the experience from foot and mouth disease and the bovine spongiform encephalopathy. And also is the contribution of veterinary biologists through their experience with the animal coronavirus. Just to let you know, for example, the head of the Chinese CDC is a veterinarian, but he's a great virologist. And also how much we are contributing because of our experience in the traceback approach to identify cases, as well as for the early detection and case finding, because this is being used for ages in the livestock diseases, and also currently where a lot of countries are looking on zoning, so we can go back in life, and that will usually come through the risk level trade facilities. So where we contribute here, or how can we contribute? For human medicine, in my opinion, you as a student, be more general and reviewing the health picture and accept the concept of health as an interaction between factors, host, environment, and agent. For veterinary students, accept the concept that the primary reason for our profession to exist to support the quality of the environment, including human health. For both, let's maintain the interest that our medical profession is to support better health, but not perfect health. And I will stop here. Thank you.
Thank you, Professor Mo, very much. Thank you for your presentation. So I would like to inform you that we will take all the questions after all the presentation will end. So please, Eleanor White, introduce yourself. You will have 10 minutes for your presentation.
Fine, thank you. I'll just try to share my screen. Can you guys see that okay?
Yes, thank you.
Amazing. So I'm going to be talking to you guys about the inclusion of comparative medicine in the veterinary and human medical university curriculums. Just to give you some background about myself, my name is Ellie White. I'm in my final year at the Royal Veterinary College in London. I'm due to graduate as a vet this summer, and I'm going to be working as a farm vet at Bristol Vet School's university practice. I first got involved with SCOVE having won their 2019 essay competition all about comparative medicine and zoonoses. And I also volunteer for a charity which promotes the concept of One Health and funds research projects in this area. So I thought I'd start with talking about both veterinary and medical curriculums as they currently are. This first slide shows our curriculum at RVC. And of course, there are variations to this between different universities and different entry routes. However, it's just to give you a general overview. The veterinary curriculum starts with preclinical training. We're taught about the normal body systems, anatomy, physiology, biochemistry, etc., etc. And then we move into our clinical years where we're taught all about actual disease processes, diagnosing these diseases and the relevant treatment options. Then our teaching ends with rotations where everything we've learned is put into practice. We practice clinical skills on placements and in the university hospitals. So then to compare, this slide shows the general approach to medical curriculums. Again, variation exists between different universities, different entry routes. They vary in different years, but this particular slide shows Oxford's curriculum. But the general point is that they both follow similar patterns with preclinical years, clinical years that follow, and then ending with rotations where practical teaching is put in place. So this slide shows 6 key areas of teaching that I believe comparative medicine is particularly relevant to and would assist in the teaching of these topics. So firstly, anatomy. When we were taught anatomy in first year, we were often referred back to the human body and put things into the context of ourselves and then apply that to animals to help us learn. And then secondly, zoonoses. The essay I wrote in the IVSA Journal of Veterinary Education largely covered the concept of zoonosis and comparative medicine. As you all know, vets work to prevent and treat these diseases in animals, whilst doctors need to know how to diagnose and treat them in people. And then antibiotic resistance is, of course, a worldwide concern, and everyone, regardless of their profession, must do their bit to help prevent this. So these 3 topics are generally relevant to both veterinary and medical students. And then we're taught a lot of public health in terms of foodborne disease and preventing this along the food chain. But of course, it's then human medics who are treating people who get sick. So again, it's teaching that's relevant to both professions when you graduate and are working in practice. Then I added in professionalism, since we're taught communication skills and ethics alike at university. I don't doubt medicine students are taught the same. So it's just something else that, although we're taught it separately, they're very much relevant to both professions. And then finally, mental health. Again, this is something that affects everyone, but especially people in these intense professions. I think it's something that definitely would be worked on together. So having spoken about the similarities between the two current curriculums and how comparative medicine can potentially play a part in the subjects taught, I'll finish by discussing the arguments for and against the potential inclusion of comparative medicine to these curriculums. So this slide kind of highlights the 4 main arguments for that I think for inclusion of comparative medicine. So improved knowledge, teamwork, preparation, and variety. And I'll go into those in a bit more detail. So started with improved knowledge. As demonstrated, many subject matters are the same for both sets of students with similar curriculums. Application of information can be done in both veterinary and medical settings, as I demonstrated with our anatomy teaching, but it can be applied to all sorts of topics that we're taught. And I think that applying it, especially for veterinary students, applying it to medicine students helps with that understanding when being taught. And that improved understanding leads to the retention of information and overall improved knowledge in a subject matter, which ultimately makes for better vets and doctors alike. So I think that's a really key argument for. Next was teamwork. So again, a necessary skill in both veterinary and medical professions. Both professions are required to work with a large variety of people within their practice, be it nurses, admin staff, reception staff, management, and then other doctors and vets alike. Always working in a team, really important. And then also working with your clients and patients, and all of that contributes to another key skill being communication skills. And I think the teaching of these and the application could always be done for both medical and veterinary students. So the next one's preparation. There will be times when transferable skills are required, times when doctors and veterinary professionals need to work together. And I think the application of comparative medicine at the university level will get students used to the idea of working together and being able to see those benefits early on and seeing how the two professions can work alongside each other. And I think ultimately it will make more people more open to that idea of working together in the future, should it be needed. And then finally, variety. The addition of comparative medicine adds a touch of variety to the current curriculum, and this would contribute to the continued engagement of students in their learning. I think it also demonstrates additional use of their degree, maybe different career paths that they hadn't previously considered. And I think ultimately it would hopefully bring more students on board with the ideas of the One Health approach to medicine. So then, in terms of the arguments against, I know when vets in the UK were first allowed to change their titles to doctor, the main argument against this change was that these are separate professions and should remain as such. My response to that would be that vets are still very much vets and doctors are still very much doctors. Comparative medicine is about collaboration and working together when it is needed. It's not about making one profession, it's just having vets and doctors being able to work together when it is needed. And I think the other argument against would be why change the current situation, which leads me on to my final slide. Much like Professor Salmon just discussed, the situation that we currently find ourselves in with COVID-19 proves in its entirety the importance of comparative medicine and collaboration between medical professionals. There, in the UK, we've seen virologists with backgrounds in veterinary health working on tests. We've seen veterinary universities and practices providing PPE and equipment to human hospitals, and even vets and vet nurses being called to assist NHS workers. It's really humbling to see, and we really are all in this together. And I think it just highlights that importance of the two professions being able to work together when needed. And I think that would start with the inclusion of comparative medicine at university. Thank you.
Thank you, Eleanor, for your presentation. Dr. Ali? please introduce yourself. You will have 15 minutes for your presentation. Thank you.
Thank you very much. Can you hear me?
Yes.
Okay, I can only share after Eleanor.
Oh, sorry. I'll try and stop. There you go.
No worries. Okay.
Good.
All right. Do you guys see the slides?
Yes, clearly.
Okay, perfect. So I'll briefly introduce myself. I'm actually already working at an interdisciplinary phase, like I'm a physician scientist, both an MD and a PhD. Currently based in Zurich, but starting next month, I'll be the senior group leader and the co-director of an institute by European Molecular Biology Organization in Warsaw, Poland. And I will also be an adjunct professor at the University of Texas Health Science Center in Houston. And like I said, I've been working at the interface of basic sciences as well as biomedicine. So it's like translational medicine, as I would call it. And we do rely a lot on animals. And yet, I very strongly believe, and I'd say even admit, that I think that the communication between veterinary and human medicine, despite the presence of these disciplines in medicine, which allow you to work with animals, I think that is definitely suboptimal. And the gap is very wide. And then I'll talk about the relevance of it, and also my ways in which I try to sort of close that gap. And finally, the relevance to the current pandemic. So of course, in medicine, we do rely a lot on the knowledge which we gain from animal models and from our colleagues in veterinary medicine. So if you think about the Nobel Prizes in human medicine, 2/3 of those actually have been awarded to researchers which were working with animals. So eventually, those researchers became more translational and were applied to humans, but they were initiated in animal models. So actually, if we look at how many of these were MDs, very few. These were basic scientists working with rodent models generally. But at the same time, what is important to consider is that a lot of times MDs and MD PhDs, they are working on animal models without really knowing their animal models well enough. And the results of that have been disastrous. And actually we published a review about that years ago when I was still a medical student. I was fortunate enough to be working with a prof in veterinary medicine. And then we started the study, which was about reliability of rodent animal models in biomedical research. So we looked at animal models both from a historical perspective, but also some of the contemporary ones. And again, this was something which we inferred, that knowing the animal model is paramount for any kind of translational research. So if we look at the example of thalidomide, that's a perfect example. And as most of you would know, it was marketed back in the 60s to treat morning sickness in pregnancy, and turned out to be a very horrendous teratogen. And it took us almost 5 years before the drug was taken off the market. And after multiple newborns, infants had been born with limb deformities, and it was a very, very tragic incident. And it turns out that again, there was not much reliance on animal models before the drug was launched. And actually there were some animal studies, even after they start seeing the teratogenic effects of thalidomide. There were some animal studies performed in rabbits, but actually they did not compare, they did not look at the timing of the pregnancy between rabbits and humans. And this was sort of this blunderous mistake in which not knowing your animal model well enough did not show the side effects which could have happened and led to a pretty tragic scenario. And again, it's very important when you are working in preclinical studies and relying on animal models, you have to consider that the models need to have face validity and construct validity. So an example of that would be face validity is when you end up with the outcome with the phenotype or the symptoms which you want to see. For example, a very well-known model of diabetes is that you give mice or rats a drug called streptozotocin, which is toxic to the beta cells in the pancreas, and it leads to diabetes. Now, eventually, of course, like the manifestations of diabetes are there, so face validity is there, but the construct validity is completely different because, the diabetes in humans, it develops in, especially type 2, in a pretty different way. So the pathogenesis is completely different, and that's why, you have to know, whether your animal model is going to also show the similar kind of pathogenesis before you try to, bridge this link at the preclinical level. So moving on with the same topic, I'll give you examples from the field of neurodegeneration, in which a lot of studies which were performed in animals were kind of lost in translation. They never made it to the clinical trials. And this is examples of a number of drugs which have been tried out in neurodegeneration. And it turns out that most of these drugs ended up having negative effects. So they were even decreasing the survival, and or they were null or conflicted, that there was one study showing a positive effect, but the other one not showing a positive effect. And only one or two were eventually having a positive clinical effect. Now, the reason is that, if you look at the very right of your screens, because again, we did not look at the animals and how neurodegeneration develops in animals. So we were also relying on certain behavioral phenotypes or certain neurodegenerative phenotypes, which are completely different in mice compared to humans. And this is again, somewhere where I think physician scientists and preclinical scientists, which are coming from the human biomedicine field, they should have relied on knowledge from our veterinary colleagues. And I think it was a complete failure of from the human medicine part. Staying on with the same, I think the concept which needs to change in human medicine is that when we rely on mouse models, we have to know the difference between an animal and an Eppendorf. So there is I would say this huge mindset which exists, in which preclinical scientists, they just see animals as a way to induce genetic mutations, to do transgenesis, make transgenic models to study a particular disease. So in the end, you are not utilizing the animal as a species, but just looking at its genome, in a way. So practically you're treating an animal like an Eppendorf, just a test tube. And I think, again, that is not something which we should be doing, because there are ways in which, you can improve the animal models if you actually start treating them as a species and not only as a tool to induce transgenesis or to study something only at the molecular level. So how we can bridge that gap? We can bridge that gap by treating animals as human-like and studying humans biologically as animals, because this is what also Professor Salman pointed out, in the end, humans are animals. There is, of course, this sense of superiority because we are let's say ruling the world right now, but in the end, we are animals, and biologically, more than I would say 90% of the pathways, they are very similar between mammals as well as if you go up to primates, then they're even more similar, and between humans. And similarly, we have to treat animals as human-like, that they also have behavior, that they also get influenced by their environment, that they also have sociability. And again, the knowledge from veterinary colleagues could be paramount over here. So I'll give you an example of how I tried to bridge that gap in my own work. So we have been studying epigenetics of early life trauma in mice. And in this model, we induce early life trauma. This was our landmark paper, Nature Neuroscience, through what we call maternal separation and unpredictable maternal stress. So again, there is no genetic manipulation involved in this model. What we are doing is that we want to simulate childhood trauma by impairing maternal care, because that is what we see in human conditions. For example, like, if you look at borderline personality disorder, if you look at bipolar disorder, the biggest risk factor for that is impaired parental care early in life. So instead of just working at a gene mutation level, we tried to induce it in the same environmental fashion by relying on impaired maternal care in mice. And when these newly born pups are separated, from their mothers for a few hours every day, they actually start behaving very similar to what we see in humans with borderline personality or bipolar disorder, or depression and anxiety. And this is something which has been more natural. And you see that the overlap between mice and humans while approaching research this way has been phenomenal. And again, as the human phase of the study, when we looked at the epigenetics of early life trauma in humans, we also treated humans as biologically as just animals. And the way, for example, we did that is because, when we look at mice in the laboratory, they are isomorphic, they're genetically very homogeneous. But when we look at human populations, there is a lot more heterogeneity. However, there are human populations in which there is high rate of consanguinity. I mean, that's unfortunate, that shouldn't be the case, but such populations do exist around the globe. And when you want to validate something from mice or any other animal model to humans, you can actually start with such populations because they will be genetically more homogeneous. So you will be able to separate the effects of your environmental exposure versus genetic susceptibility. So this has been a very, I would say smart and well appreciated method which we used. And we performed the study to validate the mouse model in Pakistan, which has the highest rate of consanguinity in the world. And again, we collaborated with the SOS Children's Village over there, because that's where we find, again, it's very unfortunate, but there are cohorts of children who have been separated from their parents, orphans who are in these villages. So because we wanted to study how early life trauma affects the brain, how it affects the epigenetic marks, and whether it leads to effects which can even be transmitted for further generations, we collaborated there. And I will just very quickly mention that after doing that, what we saw was that the overlap between the mouse model and the humans was remarkable. We saw a similar pattern of increased pro-depressive behavior in mice as well as humans. We saw changes in anxiety-related behavior in these children, which correspond to increased risk-taking and social deficits, which we see in the mice. And finally, we even see changes at the molecular level. So early life trauma, it induces changes in the cholesterol metabolism, which was very similar in the mouse model, based on this environmental exposure, as well as the human cohort, which have a very similar exposure. So this is a perfect example of comparative studies in which you are relying on your mouse model to look at humans from a biological point of view, and you are using the humans to validate. And at the same time, you are modeling trauma in mice in a natural way without going for any kind of genetic manipulation, which messes a lot of different systems up. Now, are we realizing the importance of communication between veterinary and human medicine? I guess some of us are, because I was really fascinated and amazed to see that there is an initiative like that which exists called One Health Initiative, which aims to combine human and veterinary medicine. And actually that initiative has been there for a few years. And I was looking at one of their papers in which they were talking about the recent outbreaks of zoonotic diseases such as SARS and the Ebola virus infection and the pandemic influenza. I believe they wanted to refer to avian influenza with that. And it highlights the significance of one health and one ecosystem. And I wish that there were more people who actually realized that. I wish that there was a bit more focus in zoonotic infections there was more like funding available to deal with viruses which were at that point only prevalent in animals but not in humans. Perhaps like things could be different right now if initiative like that were supported, if they actually went to policymakers, if there were other studies, you know, in which they tried to do this comparative analysis between like, you know, mice and humans. I'll end on this note that, you know, when we compare like, you know, the research between animals and humans, I mean, it's very ironic that just a few months ago, like, you know, there were like billions of animals which were you know, estimated to unfortunately demise due to the Australian bushfires. And like, I don't think I need to go into the relevance of this current graph. Everyone knows it probably by heart. But this is where I think the initiative like One Health, One World, and treating health as something where humans can influence the animals and animals can influence the humans, it is extremely, extremely paramount. I could not emphasize that enough. I would just end by like saying that we are conducting a very large study at the global level about mental health impact of COVID-19. Christina is actually one of my collaborators with that. We've already reached more than 12,000 participants within the last 12 days or so. And if any one of you would like to volunteer and help us out, especially folks in Africa, in UK, and South America, we would really welcome that. And again, it's time for all of us to come together and make a difference. And I wish we did that before. Thank you very much.
Thank you, Dr. Ali. Thank you for your presentation. Please, I'm really sorry about my pronunciation. Alaa Dafala, I'm sorry if I'm pronounced wrong your name. Please introduce yourself and you will have 10 minutes for your presentation. Thank you.
You're welcome. Can you hear me well?
Yes.
Yes, and you pronounced my name quite perfectly. So
thank you.
So hello everyone, my name is Alaa. I'm from IFMSA, which is the International Federation for Medical Students Associations. Today I'll be talking about communication of research outcomes between veterinary students and medical students. And before that, I want to thank all the speakers because you've made my work very much easier, since you've all addressed the importance of comparative medicine and translational research when it comes to One Health. And I think the situation currently with COVID has also made us understand that One Health is not a myth and One Health should be a reality that we have to practice and make sure it happens. Now, a bit of background, the International Federation of Medical Student Associations is established in 1951. We have 136 member organizations from 126 countries around the world, and we focus a lot on medical education, public health, research, exchanges, and so much more. On a personal level, I'm a final year medical student from Sudan, Khartoum, and I'm very happy to be here. So speaking about the barriers towards communication of research outcomes in general between veterinary and physicians, I think that it's already been spoken about the importance of One Health, but it's always good to reinforce that concept because One Health links human, animal, and environment health, and it's actually a strategy to expand interdisciplinary collaborations and communications. But despite that, like Dr. Ali pointed out, the communication between disciplines when it comes to physicians and veterinarians is very suboptimal. And when I was preparing for this presentation today, I took some time to reflect on my experience as a medical student. And I realized the only time in my 6 years of training that I interacted with a veterinary student was when we crossed paths in a very narrow corridor because we happened to share the same biology lab in first year, which is very unfair because if the world expects physicians and veterinarians to train together or to work together, whether in research or comparative medicine or translational research, we should be as students trained because as we know, communication and collaboration is always as a result of positive training. So thinking back, I was trying to uncover what the barriers are. And one of the first things that I noticed is that there's a lack of available platforms to promote interdisciplinary collaboration in research. The only time you are bound to collaborate with a physician, if you're a veterinarian, or the opposite, is if you happen to do basic science research or you happen to do research that involves animal models. And usually that is very late along your career, and you are abruptly put into the context and not adequately trained to do so beforehand. The second barrier that I see is barriers in interdisciplinary communication between physicians and veterinarians. And to expand on that more, I think there's first of all a lack of awareness. We are lucky to be some of the many that know about One Health and the importance of interdisciplinary collaboration, but a lot of students and a lot of physicians out there do not understand or not aware of the importance of knowing about One Health or practicing One Health. We hope that COVID-19 changes the perspectives of the world, but there is a general lack of awareness of the importance of cross-disciplinary collaboration, and this is something that needs to be addressed. The second barrier that I perceive is differences in perceptions and backgrounds. Communication, usually when people communicate, they tend to have a certain perception of things that results from their experiences. As a medical student, my perception is always in a human medicine perspective. So we tend to focus on how this affects the patient and how this would lead to better patient outcomes. But this is not the same for veterinary students. And the difference in perceptions and backgrounds is what hinders communication or hinders effective communication. Without adequate training, it would be very difficult for me to know what the perception of a veterinary student would be, and vice versa, of course. The third barrier, which is something very common but not very much addressed or spoken about, is hierarchical differences, and this differ from society to society. But speaking from my society, which is a country in the third world, there are a lot of hierarchical differences where physicians are deemed superior, which is not the case and should not be the case. But unless we acknowledge that there are hierarchical differences that affect and interrupt communication, then we will not be able to have effective communication between both disciplines. The fourth thing is, I feel there's a lot of unclear expectations of roles and responsibilities when two disciplines are forced to work in a team or suddenly find themselves working in a team. And this, of course, can be addressed by clear communication from the start, but it's usually one of the barriers because, and I'm sure Dr. Ali would agree, to what extent would a veterinarian scientist be involved versus a physician scientist? And these are things that someone would pick up slowly as they work on their research, but it would be better if there is adequate training from early on so that people have clear expectations of their role and responsibilities. Reflecting on all these barriers, I think the common problem from my perspective is inadequate training in interdisciplinary communication, especially in research education. Last year in IFMSA, we did a research or global survey to assess the extent of research education around the world, and we found that it is lacking significantly in undergraduate medical curriculum, and 0% of research education opportunities in undergraduate medical curriculum involve other disciplines. So this, I think, should be a very shocking finding, because we all know that things do not exist in isolation. And when you are learning research, you cannot learn to do research just from your perspective. So I found it quite shocking that there is no interdisciplinary communication or interdisciplinary collaboration in research education, even at an undergraduate level. Of course, that may differ in postgraduate opportunities and doctorate programs, but I'm just speaking from the perspective of students in undergraduate medical education. Now, after reflecting a lot on these barriers, the question becomes, what is the solution? We all acknowledge the importance of One Health. We know it's a strategy that is important, but we have to put in practice actions that help us achieve One Health. And I think there needs to be a greater investment in interdisciplinary training. We need to provide opportunities for cross-research projects between medical and veterinary students, and actually not just limit them to medical and veterinary students, but all disciplines as well, because this will translate as better interdisciplinary communication, which will in turn accelerate biomedical research discoveries, it will enhance public health efficacy and explicitly expand the scientific knowledge base. And ultimately, this will result in improving clinical care, as Professor Salman had pointed out on comparative medicine and the importance of translational research. So generally, I think one of the main things that we should ideally push for is greater collaboration between the students of different disciplines in an undergraduate level, postgraduate level, and more training when it comes to research and even collaborative practice. My last message would be for us to achieve One Health, we need to break down silos. And we cannot break down silos if we exist within them. And I would like to take the chance to thank IVISA for starting this webinar, because it is an example of trying to connect and breaking down silos that exist between disciplines and between professions. That being said, this is the end of my presentation, and I hope that it was insightful. Thank you so much.
Thank you, Ella. Thank you for your presentation. Now we have time for questions. So if anyone have a question, please raise your hand and ask your question. Let me check if there is any. Mm-hmm.
Muhammad, you can type your question. Christina will read it. Muhammad, can you hear us? Like you can type your question. Okay, in the meantime, I'd like to remind us of the modality. If anyone ask any question, we'll have the professor from the human medicine profession to answer the question, and also the professor from veterinary medicine will answer the question. So it will make two answers for every question. We want to have the perspectives of someone from each profession on each of the questions, like things that need clarification. I believe that is understood by all. Thank you. So we have a question from Muhammad Ali Jafar, and it reads, Professor Mo and Dr. Ali, please listen to this. The question goes to you both. It says, what should be the extent to which medical students must be introduced to veterinary medicine, and what can be some possible effective ways? So we are going to have Dr. Ali answering this question, and Professor Mo will also give us his own perspective. Dr. Ali, Professor Mo.
I thought you said maybe ask Dr. Jawad to answer first or response.
Okay. So if you want to respond first, it's not a problem.
Okay, sure. So yeah, I mean, it's a very interesting question. I think like at this point, perhaps like, slowly we are starting to see that, there is a need to have, these comparative disciplines, and there is a need to have this like sort of One Health way of looking at like, the health problems in the world. So I think that realization perhaps is there among like all the participants here. I still think that it would take a lot of sort of like convincing at like, the policy making level to introduce such curriculums. But I would say that, I can give you an example of like, what we do in the MD PhD program, where, you study medicine and you combine it with basic sciences. And at the end of it, like, at the end of the 7 or 8 year program, you get like your medical doctorate as well as your PhD. So one possibility would be to introduce something like that, that by the end of it, like, it could be an extended curriculum And by the end of it, you get like DVM as well as an MD both at the same time. The other one would be that, you know, the medical students, they perhaps like, you know, dedicated courses which are about zoonosis, like, you know, which are about like, you know, comparative medicine, introducing it as a rotation during the basic science years, and like, you know, something which involves like dedicated learning for 3 to 6 months. I would say that would be another way. But I think all these things are, you know, I think they're subject to discussion, but the most important thing is that I think at this point, we all have to concur, like at the policy making level, that we do need comparative medicine curricula.
Thank you very much, sir. Professor Mo, do I need to repeat the question, or
Well, is
you can just answer
my
directly?
short answer here is, as Dr. Jawad indicated, the human medicine should recognize that human species is one of several mammalian species on the earth. And that actually will come through the education of the instructors and the facilitators in the curriculum. And I also would like to say we should try as much as possible in human medicine curriculum to not only emphasize animals are used for experiments. Animals are part of our lives, whether it's companion animals or animals for food or animals for pleasures. And that unfortunately is not coming through the, at least in the North Americans, through the human curriculum and the education. And I will give an example here with what a very good, like, let's call it basic study that Dr. Jawad indicated about the maternity separation. And like what it needs to be done here, if there is an orientation that let's look on what has been observed, and I underline observed in animals in terms of the maternity separation and its impact, whether on cat colonies or whether cats and dogs in a shelter situation, and or in raising calves for dairies, in which like the maternity separation occurs on the first hour. And there are several studies to determine the behaviors. I recognize there will be some, I would say, like limitations in that respect as compared to the mice as experiments. But I also think they are much better with evidence than using mice in this type of experiments, as Dr. Jawad indicated, especially in the laboratory mice, they are almost becoming homogenized, like only one population. So here is like an example, a real example in that respect. And I will stop here. As the only thing I will add is, if the medical curriculum will include, as they used to be, community medicine as part of the curriculum, that means then there will be more emphasis on the preventive part. And by doing that, then both the instructors and the students will pay attention to how things done in the animal population to prevent diseases. Over.
Okay, thank you so much, sir. Thank you very much. I believe that question has been answered extensively. So we'll go to the next question. This time around, I would like Professor Mo to come first. The next question does, in the developing countries, is it practical to go for interdisciplinary collaboration? I'll repeat that. In the developing countries, is it practical to go for interdisciplinary collaborations? Professor Mo, I'd like you to go first on this.
I really would like to say, well, it is better to go interdisciplinary in that way. And actually, in the developing countries, will be much more appropriate to go interdisciplinary because of the limitation in the resources. And somebody was asking about the AMR or the antibiotics microbiological or antimicrobial resistance, there are several projects and studies and I will call outreach programs now across the world, and to show the interdisciplinary in the AMR between both the human and the veterinary, but also in the environmental health scientists, to say, well, what the other solutions and what we can do in that respect. I really think that's a good example for showing, I like to call it like this, interdisciplinary under One Health. And I want to indicate here is, as was really addressed very carefully by the last speaker, Ms. Hala, in about what happening in the world. One Health is not only to deal with zoonotic diseases. And unfortunately, that's how we translate One Health is zoonotic diseases. One Health is way, way beyond only the zoonotic diseases in that respect. Over.
Okay, thank you, sir. Dr. Ali, do you have anything to say on this?
Yeah, no, it was already very nicely explained by Professor Moore. I would just like concur with them and just add like a couple of points that I think developing countries, like, the question was, is it possible to do interdisciplinary research there? I think it's not only possible, it's actually like, it's even more possible than the developed world, And like I give an example of the study where we performed like, the comparison between like mice and humans in Pakistan, looking at the consanguinity of the population there, which makes it more homogeneous. So there are many populations in developing countries which could be ideal to do these comparative studies. And I think also interdisciplinary studies are very much possible in the developing world, because there you can rely on collaborations with the developed world, like the human part, for example, or the observation part, for example, like, this thing which Professor Moore mentioned about observational studies in animals. I mean, so many of those could be performed in Africa, and especially in Southern Africa. And I think that would be an ideal opportunity for like human medical experts from around the globe and the veterinary experts from around the globe to come together and identify how they can not only bridge the gap between these two disciplines, but also bridge the gap between the developing world science and the third world science.
All right, thank you so much, Dr. Ali. I'd like to take the next question, and it's a very interesting one. Someone asked, can there be any relation between Australia's fire and coronavirus? Can there be any relation between Australia's fire? Professor Mo, if you'd like to go first on this.
Can you repeat the question? I don't know if can be what?
Okay, yes. Can there be any relation between Australia's fire and coronavirus?
Oh, I mean, these days, and I hope like all of the participants can agree with me, there are more rumors about everything happening in the world is linked to this SARS-CoV-2. So I don't know what's the link here from a scientific aspect, but I also would like to say is, giving the social media, we need, as scientists, regardless of our background, we need to be very careful in analyzing any type of statement and link it to, in that way, common sense and scientifically based. I really think that's very important.
Oh, thank you very much. I agree with you on that. There is a lot of information on social media, and like it needs some sort of query, personal query, to choose the ones you believe. Dr. Ali, can you say something about this?
I think like, of course, like scientifically, it's very unlikely that there's a correlation, but I think there is definitely a correlation which should be more at the ethical level. That, when so many animals were at risk of dying, perhaps the reaction from the world was not as prominent as it should have been compared to now. And I think this is the point which I wanted to emphasize, that in the end, humans are just like, they're just animals. We are social animals, but we are still like animals, and like this is the important thing, that when there was a catastrophe which was affecting the animal world, the response should have been much better. I mean, this should be used as a source of realization that, we didn't care about all the species which were endangered then, and now we are the endangered species ourselves. And I think that realization definitely has to be there. And no matter whether you're a scientist or like a human medical expert or anything, that realization has to be there in everyone, including policymakers. Thank you.
Thank you very much. I believe that question has been answered so extensively. Thank you. That takes me to the next question. It is still unclear for me. So what is the actual difference between comparative medicine and conventional biomedical animal laboratory research? I'll take the question again. It is still unclear for me. So what is the actual difference between comparative medicine and conventional biomedical animal laboratory research? So Dr. Ali, would you like to go first on this?
Okay, I think Professor Moore definitely, like I'll defer to his opinion. His opinion will be definitely more of an expert. I'll just quickly say that I think, again, like, we shouldn't just be using animals as models for biomedical research. Comparative medicine is not about using animals for research. That is being done anyways. That is also patronized. I mean, most of the preclinical models are animals, but I think comparative medicine is to also look at animals in their natural habitats, studying their physiology and compare them, their pathophysiology, and then make comparisons with humans. And Professor Moore, maybe you'll have like a lot more to add.
Well, I agree with the way you said it, but if I want to say is comparative medicine is more broader, and the experimental animal and laboratory and what they call now, actually with the specialty, a board specialty, lab animals medicine, that's, I like to call it like one of the components of the comparative medicine, but not everything in that respect, as Dr. Jawad indicated in that respect. But I want also to follow up about the kangaroo, and I'm in agreement with Dr. Jawad in that respect, about like the ethical part of the equation here. I would like to bring the issue about, we already destroyed 80 million pigs in China since August 2018, mainly because of the viral disease. It's called African swine fever. And yes, there is ethical issue here, but also I will call it from the human side, there is an ethical issue of sacrificing a lot of food sources in that respect. And I don't think we have linked that to the food security in the long run by the, let's call it, by the common public interest in that respect.
Thank you very much, sir. I believe that question has been answered comprehensively. So the next question is, would better development in comparative medicine change the COVID-19 scenario? Someone is asking, would better development in comparative medicine change the COVID-19 scenario? Professor Moore, can you go first on this?
I don't hear you very well, and I don't see the question on the chat.
Okay. The person is asking, would better, I would copy it and paste it in the chat, but the question is, would better development in comparative medicine change the COVID-19 scenario?
I will give it a shot if you don't mind, Dr. Joad. I don't mind whatever you label it. I really would like to say is the most important is the concept and the message. And I don't blame it on the students, since we have a lot of students here. I really blame it on the decision makers in building the curriculum and to make it more in compartments instead of make it more general. That's across, by the way, across both the veterinary side and the human side.
Okay, thank you. Dr. Ali, do you have anything to say on this?
I absolutely agree. I think again, like that should also be the focus of, like, let's say if we come with a consensus after this meeting, that is that, yeah, we do realize the importance of like One Health and comparative medicine, but the question is, like, do the policymakers, do the people sitting at top, do they realize it? And I think and that is why, like, I would propose that, maybe, like, you students together take the lead, and maybe Professor Mo and like me, we can supervise that. We should really write an opinion piece on that. This has to go to mainstream media, and like we should also emphasize the fact that, yeah, again, I mean, I believe that comparative medicine and a better communication between veterinary viral researchers and like human researchers definitely could have come up with like a way in which maybe the COVID-19 could have been, even prevented, or at least its harmful effects could have been lessened. And I think this is like a key message which we want to convey, that this is the importance of realizing the knowledge which we can gain from animals, and again realizing that humans, like, human population dynamics are changing not only animals but also zoonotic viruses, and like, the whole repertoire of the microorganisms which exist there. And this really should go out to the policymakers.
Thank you very much, sir. Going by the fact that we are running behind schedule, I'd like to leave the next questions, the subsequent questions open. It's going to be one answer from any of the speakers. It could be the professors or the student speakers. So Eleanor and Ella, this is your chance to answer questions if you like. Um, the next question is, what should be the role of field veterinarians to promote One Health concept and reduce the communication gap between medical and veterinary professionals? I believe the students you answer this. Ellie or Ala, if any of you wants to go. We're taking one answer per question. Henceforth. Should I read the question again?
Yes, please do, because I think I didn't hear it well.
Okay. So what should be the role of field veterinarians to promote One Health concept and reduce the communication gap between medical and veterinary professionals? Did you get that?
Yes, I did. Although, of course, I feel Eleanor is better suited to answer this question. My take on this would generally be that more awareness initiatives are in need. But yes, Eleanor, please go forward.
Yeah, I was just thinking that I think it really starts at a university level. I think to get vets and doctors kind of used and break, like you said in your presentation, Ala, kind of breaking down those barriers to begin with at a student level, rather than expecting sudden communication to happen with vets already in the field. I think it's kind of a slow process that will start at that university level. And then hopefully as people graduate and move through and people are used to working together, then that communication gap would hopefully diminish.
Okay, thank you very, very much. I love that answer. So the next question is like a specific.
Dauda, I'm sorry, before you proceed with the next question. Allah have to leave us for another meeting. So I would like to thank her for her participation and for her presentation. Allah, can you hear me?
Yes, I can. Thank you so much. It's been an absolute delight to be here, and we hope to interact and work together more. Thank you so much.
Thank you
Okay,
so
so
much.
thank
Thank you
you.
very much.
I appreciate your presence. Thank you.
Okay, Dauda, we can continue with the next question.
Okay. Um, the participant is saying, I think one of the differences between human and veterinary medicine is that the veterinary medicine is considered as industry in many places, specifically at developing countries. So how can we get over that? So in simple terms, the person is asking how we can get over the concept of veterinary medicine as an industry rather than like a profession in developing countries.
Is that, I assume the question came
Yeah,
to me. I really like that labeling, is the industry rather than medicine. But I also would like to say, and especially like in North America, and I hope like Dr. Jawad will agree with me, and well, North American as well as Europe, is medicine in general is becoming a commercial. So is not like we are different than the others in that respect. The only difference here, be honest with you, is in veterinary medicine, uh, we put a value for any type of intervention measures, including a treatment or surgery. We put a dollar value for it. In human medicine, so far, it's not being done that way, at least in, let's call it, majorities of countries, except like United States, because still we go with that. I mean, like, because we depends on insurance company, how much they pay or not. So that respect in human medicine is becoming also a commercial, because is if I am an oncologist and somebody will come to me, and this has happened, I mean, and I hope like Dr. Jawad will agree with me here, is as, at least here in the United States, the oncologist will say, well, let's see how much your insurance company will agree to pay for any type of chemotherapy or whatever. So commercialization as or industrialization of medicine is not far away. And I have some observation of what's going on now with COVID-19. Is the first time in the history of humanity we are trying to put some priority. Who should go under the ventilators and who should not? At least now in the media and including the medical community, they are talking about that. In veterinary medicine, this been practiced for a long time. Okay, as I said, because we could sacrifice animals, unfortunately. But with the human medicine, now that type of issue, and I'm not saying is ethical, by the way, I'm saying is it's being discussed the first time in history of humanity. And I will stop there.
okay, thank you very much, sir. Sorry guys, we won't be taking any more questions. I'll read out the remaining questions and we'll get one answer for them each. But any question coming in now won't be answered. I'm very sorry about that. We're out of time. That's why. Sorry. So thank you very much, Professor Mo, for that answer. The next question will be, what type of projects or researches can medicals and veterinary students start at their level? Any suggestions? Ellie, if you want to go on
Yeah,
this.
sure. Yeah, no, I read this, so I was just thinking about it. I would just encourage anyone to get involved with their university, kind of talk to lecturers, talk to researchers that are at their university and see what they can get involved with. At my university in particular, we carry out a couple of research projects of our choosing throughout the course, but I don't doubt that not all universities are the same. So if people are particularly interested in that, I guess it would be a case of talking to their staff and seeing what opportunities are there.
Oh, thank you very much. I'd like to add to that from my own perspective too. I think students can also get involved in surveys, like initiating and filling out surveys and actually writing research articles and so on and so forth. There are lots of things that our students can do, but the thing is, people don't get the right exposure. And as one of the speakers rightly mentioned, exposure is very key in One Health. Thank you. So, um, the next question is, hello, as Professor Moore said, One Health is so much more than just zoonosis, and I cannot agree more. There has been recent talk of One Wellness in veterinary community, and my personal view of this is that the well-being, as defined by WHO, is a stronger concept to build bridges upon as it includes many different aspects of health. My question is, what does our respected panel think about this? In a nutshell, what do you think about One Wellness in veterinary practice? I think Ellie and Professor Mo, this goes to you guys. What do you think about One Wellness in veterinary medicine?
Can you raise your voice a little bit and just repeat the question, please?
Okay, the question says, what do you think about One Wellness? There's a concept of One Wellness that is gearing up in the veterinary community,
Oh, okay.
and the participant wants to know about the One Wellness concept. I think I've seen something like that on WhatsApp too.
Well, I can tell you now there is a team in Harvard University. They are promoting what they call planetary health. It's mainly to look on the health of the planet in general, in which like mainly they emphasize on the health of the environment, and part of that is the human and the animals as well as the plant interaction and synergism. Again, I don't want to say well, I don't care how you label it, is the concept. uh, the the wholeness approach, if that's what the question is, the wholeness approach is really like the only way if we want to move forward in getting a better understanding of our planet and the quality of life in our planet.
Oh, thank you, sir. Ellie, do you have anything to say on that?
I don't really have much more to add, really. I agree with what was said.
Okay, thank you. It just got to my notice that some people are raising their hands. They want to talk. I already said that you're supposed to type the questions and not raise hands. We're very sorry about that. I think with that we have come to the end of the webinar. Thank you, Christina. You can take over.
Thank you, everybody.
Thank you, Christina. Okay, so thank you everyone for participating. We appreciate your presence and we really wish to have you on board next time. Uh, we'll be having much of these in recent times, and we hope to enjoy your presence subsequently. If you have more questions for our speakers, we're going to make their emails available in the communication system for the webinar platform. And we are also going to send you guys the PowerPoint presentation as well as the video recording of the entire webinar. And with that, I would say enjoy your day and goodbye, everyone.